So this programme has been the best thing I've done in terms of my leadership development. I've learned so much about myself. I feel I know myself inside out, which has been really great, and having that self-awareness of the impact that you can have on others, and therefore moderating or changing what you do to have a different impact. Just that ability to do that has been really amazing.
One aspect of the programme I found really helpful was the opportunity of working with a national team on an important national policy area, and the area I worked on was the agency medical work. That allowed me to see how central teams at NHSI work and to understand how Department of Health and political priorities were translated into NHS policy, and then in turn how those were implemented at local organisation level. And that was something that, working in a provider organisation before, I'd not really had the opportunity to gain that insight.
It's been really good to get some time away, to clear your head, to think about aspects of leadership and the challenges that we face in the NHS. And it's been fantastic to work with such an enthusiastic, motivated and committed group of people, both the participants and the facilitators. So for me, I think it's been an invaluable year. It's given me lots of time to think, look at things differently, develop new skills and behaviours. And in a nutshell, it's probably the best development programme I've ever been on.
I don't think I would have ever applied for a chief exec's job if I hadn't have come on the programme, because it's given me the opportunity to try things out before I might actually need to do them. And it's also given me the ability to test some of the doubts or issues I think I might need around development in a safe space. So it's allowed me to learn before I apply for a job and then hopefully get to do it.
It is worth it because you do think differently, you look at the system as a whole, you have competing priorities, but we are the leaders of the future. We have to change the system in order for the NHS to work going forward.
At times you can sometimes just accept the status quo, but I think what the programme does and absolutely encourages you to do is just ask that awkward question or ask that silly question. Say, well, why are we doing like that? And you're saying this, but actually what I'm seeing you actually do in reality is something completely different. Let's have a conversation about that.
So some of the things that I've been doing personally whilst being on the programme is working closely with GP federations and CCGs to integrate services with our acute physicians going out into the community to support patients to try and reduce the demand and the load on the front door, and working with a community hospital in our area, again making sure that we have a fluid bed base and we can discharge patients in a safe, timely way.
One of the things that have really made an impact on me was the patient mentor. We were requested a year ago to get a patient that we had to mentor, and I have a patient called Richard who is a renal patient, and I meet up with him every month for a couple of hours, and the discussions that I have with him have been invaluable. It's enabled me to think about the system and how we don't prevent or screen for renal failure in our system, and I work in East London, and so that's something I'm going to try and follow up with. I've had conversations with public health in our hospital and the renal physicians, but I really do want to pursue that. And also he highlights things that are happening on our wards, which actually we could make a difference if we change the way that we work as a workforce. So that has been really, really invaluable. But the thing that I'm going to be doing with him, he asked me to be part of a steering group for home dialysis. So he's championing home dialysis, and I'm going to be right with him championing that to move to increase the number of people that we have on home dialysis at our hospital, which will be really good for the patient and also good for the hospital as well, because it frees up capacity to take more patients. So